Hello, everyone. Amanda Williams, MD, MPH, here with you to talk about skin hydration. And this is very important throughout the year, but in particular when we think about the dry, colder months, because certainly your skin can take a hit during those times. And I want to focus specifically on hyaluronic acid, because hyaluronic acid is incredibly important for the health of our skin when it comes to maintaining the hydration of the skin. If we are lacking hyaluronic acid, that can become a really big problem. And we know that hyaluronic acid is one of the main components in the extracellular matrix within the skin. And that's essential when we think about the hydrating impact. And there's many very unique qualities about hyaluronic acid. One thing is that as we get older, similar to collagen, our hyaluronic acid stores begin to diminish, which can certainly be problematic when we think about the health of our skin. Because in that type of a situation, if we're losing hyaluronic acid as we get older, we can start to see those effects in terms of the health of the skin and the appearance of the skin. So you may find that you're getting more fine lines and wrinkles, which nobody likes. You may find that your skin feels drier. You may find that the elasticity within the skin begins to diminish, which is why we want to make sure that we address this issue. I talk often about taking collagen for the health of our skin, our hair, our nails, our bones, the blood vessels. Well, hyaluronic acid is a similar thing that we should also be taking as we get older because hyaluronic acid is also critical when it comes to not only the health of our skin, but when we think about our blood vessels, when we think about our joints, which is why oftentimes people will take hyaluronic acid to ease inflammation and ease discomfort within their joint spaces because hyaluronic acid provides that gel like cushioning within the joints. And so if we're losing that, then we start to get more of that abrasiveness within those joint spaces. So the knee is a perfect example of that. But since we're kind of focusing today more on the hydration factor and the skin, then we certainly want to look at the science behind taking hyaluronic acid. It's not always about the topical application. Obviously, there's many things out there on the market that address the loss of hyaluronic acid, and you can topically apply these. But I like to also address this internally because if we can replenish things that we know that we have lost, then that's always a beneficial thing. So when we look at collagen as well as hyaluronic acid, the internal introduction or reintroduction of these nutrients is really quite important for your overall success for targeting those fine lines and wrinkles. So we have a couple of different products that contain hyaluronic acid. We have our hyaluronic acid capsules, which also contain devil's claw extract in it, which is beneficial for joint health, but also you're gaining that very important hyaluron for the skin. So oftentimes people will utilize the that particular product, the hyaluronic acid plus devil's claw for their joints and then come to find out they start to see the noticeable effects when it comes to their skin health and the skin starts to improve. So that's always a benefit. But we also have our Collagex HA, which is a combination of hydrolyzed collagen along with hyaluronic acid. So this is a really nice combination to address two things that we know our skin and our blood vessels really require. And we want to make sure that we maintain not only the health of our skin, but also, yeah, our cardiovascular system as well. So in the Journal of Complementary and Alternative Medicine, they looked at the impact of taking oral hyaluronic acid and to see would this have any type of an impact because the topical application of hyaluronic acid has been tested and is well known in terms of providing and yielding those benefits. But they said, well, what if we take the hyaluronic acid and have people use it internally as an oral supplementation? Would we still yield those same benefits? And not to their surprise at all, indeed, that hyaluronic acid oral supplementation did help the skin. So they found. a reduction in the wrinkles, they found an improvement in hydration of the skin, and they also found an improvement of the elasticity. So, all of these things are all very beneficial. So, especially if these are concerns that you may have. So, perhaps your concerns really aren't the fine lines and wrinkles, but maybe you do have dry skin and you notice that your skin is drier in the cold months when the humidity levels are definitely much lower. So maybe even during the winter, it would be advantageous to make sure that you include either the College X HA or the hyaluronic acid with devil's claw as part of your supplementation routine. Because at the end of the day, if we know that we are losing something because of just the aging process alone, we know that with collagen, for example, by the time we're 50, 60 years old, we've lost a good 50% of our natural collagen stores. And the same is said true when it comes to hyaluronic acid. So we definitely want to make sure that we pay attention to these things and that we are proactive in our approach because it's not just beneficial for the outward appearance, but it's also incredibly important for what is actually occurring internally. So I encourage you to go to our website, invitehealth.com, and look at those products, the College X HA, as well as the hyaluronic acid plus Devil's Claw. Now, I will be back with you in a few more days to talk about more wonderful formulations available at Invite Health. Thank you so much.